So why do you want to be a doctor? These type of questions aren't unusual at all, and I call these high yield areas. And it's important you revise and you prepare for these moments. In a question like this, right, what the interviewers are after is, have you got insight? Have you got real motivation? Something that's authentic. Have you reflected? And are you avoiding cliches? What do I mean by all that? Let's explore this. So the first thing I want you to dwell on is your experience. I'm sure you'll have shadowed perhaps a GP, you'll have spent time in a hospice, you might have done some time in a care home, you might have gone into a hospital, but don't also forget those volunteering in the community, those jobs you did perhaps, working in a restaurant or helping mum and dad out with their business, for example. All these things do also count as work experience. And there's lots of skills that you can bring across from other sectors. For example, you might have dealt with a dispute you came across between, say, a couple of customers whilst they were dining in your restaurant. You might have, come in a leadership position with helping out with the football club that you help manage in the grassroots league locally. So it's not always medical that counts as experience. What we need to do is, with these experiences, we need to be able to talk about them, and also we need to be able to kind of show insight into realities of doing jobs and what it involves with working with people, looking after patients. So I say to you, what have you learned? And this is where reflection comes in, the second part, reflection. When you reflect on that job experience, I need you to be able to bring forward a few things that you observed and learned. You might have noticed that it's a complex situation. There's a lot of complexities around, for example, decision making. Emotion. There's a lot of emotional purchase, right? When it comes to dealing with patients, customers, decision making, there's a lot of emotion required. How do people handle that? How might you handle it? You'll also find that these jobs aren't working in silo. It involves working with people who bring different skills to the table. So teamwork, you might want to look at that. What about this thing about empathy? Empathy is fundamental in these situations, but there's also something to be achieved clinically. There's a job at hand. How do you balance the two? So have a think about that and be able to bring these things out in your discussion. Examiners, interviewers love this. They love reflection. But what they don't particularly like is hero worshipping, i.e., I saw Dr. Foster and I loved what he did, No, focus on what he was doing. What was the job involved? What was they doing in the work? That's what they're interested in. So the third area that you need to then look at is motivation. Now that you've spoke about what you've come across and you've reflected, you need to look at your motivation, right? What motivates you? What drives you as an individual towards this job? So people say things like, I love problem solving and I can see how the work resonates with me. Other people say, look, I'm really motivated by the fact that I can build long-term relationships with people, colleagues, and especially patients. Other people are quite active, hands-on. So they talk about, they like the fact that it's a practical, hands-on work, and that will work well for them. Especially for those of you who are going to do hands-on jobs within the field of medicine and dentistry, and they want to, be practical in the work. Other people say to me that, look, I'm really drawn towards this career because there's an element of science, lots of science, lots of development, but then also they can practice this in a community with people. So it's a bit of both. They can take the scientific side and deploy it with people, looking after people. Now, the excellent candidates take it one step further, and then they bring in the realities, the future of the NHS. They've noticed in these experiences that there are pressures involved in the NHS, the 10-year plan, the increasing complexity of the work because of patient needs. People are living longer. There's people who speak different languages. People are surviving with more complex medical problems, with more complex medical interactions, more complex medications. And so there's complexities in the job that need to be looked at. People talk to me about lifelong learning. Now, don't shy away from that. You, for the past many years in your life, you've been hardworking. Your GCSEs are equivalent, your A-levels are equivalent. You know, you're going to continue that into your career, both as an undergraduate and as a postgraduate. So let's be real, let's talk about it, you know. Quite a few of you, especially your generation, you're technophiles. You love innovation, you know, working with computers, working with AI, working with tech, apps, digital and so forth. You know, that should excite you. This is a big thing in medicine. You know, talk about it if that resonates with you.